Welcome friends, welcome on MuniMeterHealth, your source of learning about the human heart and cardiology. We are enhancing medical education and patient education one discussion at a time to improve the clinical outcomes. What are heart valves? That will be discussed briefly today. The heart valves are tissue-like structures which are present within the heart, separating one chamber from the other. Now we know there are 4 chambers in the heart, so therefore we must have 4 valves, as simple as that. So let's draw the schematic of the heart and show you exactly what we mean. So here are the 2 right-sided chambers, top and the bottom. Here are the 2 left-sided chambers, the top and the bottom. So how many chambers? We got 4 chambers. The 2 chambers on the top are called the atrium. The bottom chambers are called the ventricles. This being the right side, this being the left side, as we know. Now, the valves are situated somewhere here, obviously separating one chamber from the other. So we'll show the valves in this color schematic. We have valves here. So this is being shown as 3 leaflets. So it's called the tricuspid valve. This is bicuspid valve, or also called mitral valve. And then basically what's happening is when the top chambers, they squeeze, they send the blood in the direction as shown here. They will be shown, the blood is sent down here like that, and the blood is sent down here like this. So in other words, the top chambers, when they squeeze, the blood will be sent to the ventricles or the bottom chambers. Now when the ventricles on the in their turn, when they squeeze or when they contract, they will send the blood upwards into their conduits or vessels which are originating from these ventricles. So the right ventricle and the left ventricle here. The right ventricle will send the blood into the lungs for purification or oxygenation. The left ventricle will send the blood to the rest of the body and supply the oxygenated blood to the rest of the entire body. So you should have valves here as well, because otherwise the blood will flow back in. So the valves situated here will be shown in this schematic, if you will. I can show you somewhere like that. These are your valves right here. So these valves, again, we have 4 sets of valves, 4 sets of chambers, and essentially we are showing these valves primarily to make sure that we understand what they are. So this one is called the tricuspid valve, being 3 leaflets. This one is called the mitral valve. This one is called the aortic valve right here, which is situated in the aorta, and this is the pulmonary valve, which is situated in the pulmonary artery. So pulmonary valve, aortic valve, mitral valve, and of course the tricuspid valve is right here. So again, what are the functions of the heart valves? Essentially separating one chamber from the other, as you see, and providing a unidirectional flow. In other words, the flow of the blood is only in one direction. When the top chambers contract, the flow occurs and the bottom chambers receive the blood. Now when the bottom chambers contract, these valves will close, just like your door in the house. Remember, your door just opens or closes only in one direction, right? When it's separating one room to the other. Similarly, here these rooms are separated from one to the other by these door-like structures. These are very fine tissue-like structures called the heart valves. Any malfunction that occurs within these doors will result into regurgitation or a backward flow, or sometimes if they are too narrow, they don't open, it's called stenosis, and those things we'll discuss in the next video, as you see. Okay, so I hope you enjoyed this discussion of heart valves, and stay tuned and keep learning on MuniMeterHealth, your site of cardiology and human heart learning.